We'd like to thank everyone for joining us on our Mental Health Matters Forum. We hope you will join us each second and fourth Thursday at 11:30 for a new topic and conversation. We are SC Thrive, a nonprofit organization that leads South Carolinians to stability by providing innovative and efficient access to quality of life resources. Today, we have a special program focusing on older adult mental health called Talk Saves Lives. We'd like to welcome back our guest today, Elaine Shell, Physicians Liaison for Prisma Health in Columbia. Welcome, Elaine.
Hi, can everybody hear me okay, I hope?
Yes.
Great. So I serve on the American Foundation for Suicide Prevention. I serve on the South Carolina chapter board, and I appreciate being invited here today. I have been at Palmetto Health, which is now, of course, known as Prisma Health Midlands, for almost 19 years. Prior to that, I did social services at several nursing homes and was the director of an assisted living residence. Can't believe it. I've been in healthcare for 30 years. I'm also active in an organization called The Friendship, which is a new not-for-profit in Columbia that helps seniors age in place. We recognize that people need help with some of the little things like changing light bulbs or getting a ride to a social event. We're trying to prevent loneliness and isolation, especially during these times of COVID. So I think that might be another presentation for a future date, but I wanted y'all to at least know about The Friendship. Suicide is what I'm going to talk about today, mental health in seniors. And I know that suicide can be a very sensitive topic to discuss, but remember that talking about it is critical to its prevention. We're grateful that you invited me to be part of this discussion today. Before I get started, really, I want to make sure that you know that I am aware that people who are listening right now who have been affected by suicide. And if that is you, I want you to know how sorry I am that it has affected your life, and I'm sorry for your loss. And I know that I am not here to say, if you'd only done this or that, your loved one would be alive, because I really don't believe that. But I do believe this: most people can be saved. It's kind of like the starfish story. You make a difference one person at a time. So let's get started. I want to make sure that you realize by the end of this that this really is a health issue, and a complex health issue. There's not very easy answers. Despite its complexity, most suicides can be prevented, like I said. Just like there are warning signs and risk factors for other health crises like cardiac arrest, we can learn the warning signs and risk factors that can help us prevent people from dying by suicide. As with other health issues, time can be a critical and life-saving measure. Typically, a life can be saved if you allow time for the person's suicide risk to subside, or to get through that period of distress and to get the mental health help that they need. To prevent suicide, we need to identify persons who may be suicidal, as well as take an active role in connecting them to help before they take action to end their lives. So the purpose of this Talk Saves Lives presentation is to provide people like you with a general overview of what suicide is, who it affects, what we know about it, and what we can do to prevent it. It will cover some statistics to give you an idea of the scope of the problem. We will review some key research findings, including the risk and protective factors that relate to suicide. I'll share some information specific to seniors and suicide, and we'll talk about what works and what we can all do to prevent this leading cause of death. The first thing I want to talk about is how we talk about it. It's important to model appropriate language so that we do not perpetuate the stigma of suicide for mental health conditions. So some of the do's and don'ts you can see here on the screen. We want to kind of establish this shared language. We avoid using the phrase committed suicide, and that's going to be hard, I think, to get out of our language because that's the phrase that most people say. But I want to encourage you to really try to say died by suicide or ended her life, killed himself, and try to get away from some of that negative connotation that has. When we're talking about suicide or suicide attempts, please don't say that it was a failed attempt or a successful attempt, because when you think about it, those words are actually backwards. We would want a person to not die if they attempted suicide. We would want them to live. And I would also like to ask each of you to pledge never ever to joke about it. This is not a subject that we should be joking about. We don't joke about cancer, but yet people find it okay to joke about suicide. And I think it's hard to speak up when somebody's doing that. But I think just like some other issues that are going on in our country right now, we've got to be brave and we've got to speak up when someone is saying something that is not appropriate. So the scope of the problem, it really is a significant issue. It affects so many individuals, families, and communities. So we'll start with a few statistics. According to the World Health Organization, over 800,000 people a year die by suicide worldwide. And the problem too is that we don't really know if that's accurate because a lot of countries don't report. We feel like they underreport their problem. If you think about that, about every 40 seconds. According to the CDC, more than 48,000 people died by suicide in 2018. So putting that into kind of a realistic number, that's about 130 people a day. So if you think about a plane crash that kills 130 people, if that was happening every day, I know people aren't flying right now because of COVID, but they certainly would not be flying if a plane went down every day. We would stop it and say, what is going on here? Suicide is the 10th leading cause of death. It takes more lives in our country than homicide, war, and natural disasters combined. So I'm going to give you a minute to process that because that's a high number. And it's about twice as many people who die by homicide. And if you think about, again, we hear about a lot of homicides, but we don't always hear about the suicides. And these high numbers are one of the many reasons that it's important to talk about it. Like any other illness, the more we talk, the less stigmatized the topic becomes. We're going to come back to this slide or this material a little bit later, but I want you to just put in your head about for every death by suicide, 25 more people have attempted. So that's about 1 million people every year who survive an attempt. This loss affects family, friends, coworkers, neighbors, schools, faith communities, etc. And it's estimated that the majority of Americans will experience a loss over the course of their lifetime. So again, I want you to think about if that is you or someone you know, there's a lot of people out there like you, and there's a lot of support and help, and we're going to talk about some of that. Doesn't make it any easier to bear, but I think sometimes knowing that others out there have the same issues, it can be comforting. Sadly, sometimes it has to come down to money to make people pay attention. So the Centers for Disease Control and Prevention estimate that suicidal behavior, that's including attempts and deaths, cost the United States $69 billion a year, primarily due to lost wages and lost productivity. Let's move on for a minute to research. Only in the last several decades have scientists been studying suicide, and research is shedding light on many critical areas, but we still have more to learn. One of the main questions research explores is, why do people take their own lives? Through research, we have learned that there is no single cause for suicide, but it most often occurs when several stressors and health issues converge to create an experience of hopelessness and despair. Research consistently shows that a large majority of people who die by suicide have a mental health condition at the time of their death, but it may or may not have been diagnosed or adequately treated. That said, research has also made clear that mental health conditions cannot be the whole story. The vast majority of people who have these illnesses do not die by suicide. You can see there, 1 in 4 people have a mental health condition. In addition to mental health conditions, there are many other factors that increase risk as well. We've learned that the brains of people who die by suicide differ from those who die by others, specifically in the areas related to the stress response and impulse control. And I'll give you a minute just to think about that. That impulse control, I think, is critical. We've also learned that most people who are suicidal are ambivalent about taking their own life. Part of them really wants to live, and only part of them wants to die. So we need to engage that part of the person who wants to stay alive and create distance from the part of them that wants to die. One way we could do that is to help the person connect with reasons for living, while at the same time decreasing the visibility and presence of things around them that may facilitate that desire to die. One of the other important things that we've learned is about the perspective of the person. So think about this. They have reached a crisis point. The pain is unbearable, whether it's emotional pain or physical pain or both. Think for just a minute, if you were having a major heart attack, you might be able to say, call 911, but you wouldn't be able to think much else. So that pain makes ordinary thinking impossible. So think about suicide ideations kind of like a brain attack. Thinking becomes constricted at that very moment. They get into a state of intense tunnel vision, and they can't foresee a time when that unbearable pain will end. So they can think, I cannot live like this, and therefore I must die. They can't think beyond those statements. So it's also helped us learn that suicidal feelings are often temporary. I think this is one of the main cool things about research, is to think about that. These feelings can come on intensely, but they can sometimes pass in minutes or hours. So keeping a person safe and helping them feel supported can get them through those critical moments. There's evidence that putting time and distance between an individual who is suicidal and the means to take their own life will make the difference. Think about a person who has a plan A, but they have not thought ahead to a plan B. So if plan A doesn't work, or they don't have the means at hand, they don't have the ability to think ahead at that moment. Now, they might think about it later. They don't have that ability to think, what do I do now? They just stop. So who is at risk? Research has also helped determine the key risk factors that increase the risk for suicide. And you can see them here. This helps us understand the big picture of someone who is considering suicide. So just like someone who is at risk for heart disease because of high blood pressure or a history of heart disease in the family, some people are at a higher risk for suicide than others. So there are 3 categories: health, historical, and environmental. I'm going to look at each of these a little closer. The first type of risk factor includes health factors, such as biological and psychological medical conditions, the most significant of which, as we've already discussed, are mental health conditions. As I said before, most people who die by suicide have an active mental health problem at the time of their death. Depression is the most common mental health condition and is one that is most associated with suicide. Bipolar disorder is also shown to be a high risk, although it is much less common than depression. Because these conditions put a person at greater risk, detecting the presence of a mental health condition is critically important. The best way to be sure when you feel concerned or detect a possible change in you or your loved one's mental health is for the person at risk to seek a professional evaluation and get effective treatment. I know I said that like it's easy. It's not. Mental health conditions are not the only health factors that are associated with suicide risk. Serious or chronic health conditions can increase risk, especially if the person has mental health issues also. Chronic pain, serious head injuries have been found to increase suicide risk. The second type of risk factors include historical factors, such as a family history of medical conditions, or past trauma, such as sexual abuse or combat stress. Research has also found that a history of childhood abuse can contribute. And while most people who attempt suicide do not go on to die by suicide, previous attempts also put a person at increased risk. I found it interesting, I'm going off script here for a minute, that family history of suicide. Logically, you would think that if a family has experienced suicide, that no one else in the family would ever do that because they can see the pain that it caused. But in reality, the opposite is true. If someone in the family has died by suicide, the rest of the family is more at risk. So it doesn't seem logical, but it's true. So keep that in mind. If you know someone who is struggling because a loved one died by suicide, they really are at high risk. The third type of risk factor are environmental factors that involve the circumstances of a person's life. Often there are aspects of a person's environment that can contribute to their overall level of risk. So let's look at a few of these. Having access to a way of killing oneself is referred to as access to lethal means. This includes having access to a variety of things, such as firearms, drugs, a bridge, or a car. Research has shown that contagion, like I just mentioned, exposure to another person's suicide, or to graphic or sensationalized accounts of suicide, especially among those other risk factors, can increase a person's risk. Prolonged stress may include harassment, bullying, relationship problems, legal problems, unemployment, caregiving, and stressful life events, which vary across the lifespan, include experiences like divorce, legal problems, or job loss. And y'all, COVID-19 has totally put so many people into these categories. This has been a really difficult time for a lot of people. I know that you know that, and I know that you're talking to people who are dealing with this, as you are. To better understand suicide risk, here is an example of a set of risk factors that could converge in a person who is suicidal. This example shows what is often the public perception of suicide. When someone dies by suicide, often the story only talks about environmental factors. People see a life event like a breakup or bullying or job loss, and then they see the person die by suicide. So they might assume that the person killed themselves because of that stressful life event. But it's never the whole story. What others don't know is that the person who died may have had genetic risks for suicide. Maybe they were also suffering from depression or anxiety. Their work life had become increasingly stressful. The underlying depression or anxiety could have made the situation at work even worse, or the work stress could have made the depression worse. Perhaps they'd also been drinking more than normal. The key is that it's the combination of risk factors that could have contributed to this death. Looking to the future, research will help us find the best ways to fight suicide. Researchers are looking at biomarkers, for example, something that is testable in a blood sample that could help us identify people who are the most at risk. And a number of clinical treatments, like particular types of therapy, are effective for suicidal people, and more need to be developed and studied. The good news is that through research, we are learning more and more about what helps those who are in a suicidal crisis. Research can also help us identify the most effective interventions to reduce suicide rates and to reduce risk in those suffering from mental health conditions. I'm going to talk just for a minute about seniors and suicide. Although suicide rates are highest among Americans 44 to 64, the rate among Americans 65 and older is still higher than the national average. And men over 65, the rate is very high. A few minutes ago in the beginning, we saw that the general population, for each death by suicide, it is estimated that there are 25 attempts. However, when a senior attempts to end their life, those attempts more often result in death. Some of the reasons for this include things such as isolation, greater access to lethal means, and the increased likelihood of a serious health condition that would make them less likely to survive a life-threatening event. And think about this, y'all. We're in South Carolina. There are guns everywhere. Lots of people grew up with guns. They grew up hunting. So it might not be as difficult for a senior to put their hands on a firearm as it would be for a younger person. And they also, I feel like they choose that more lethal means. Whereas a young person might try pills, an older person has those pills already because of what they're taking or what they can get, and they are more likely to result in death. But remember that depression is not a natural part of growing older. It is an illness that, left untreated, can become fatal. So some things that contribute to a senior's risk. More likely to have experienced the loss of a life partner, close friends, or family. For many, especially those living alone, maybe losing a pet, that can be a significant loss. Changes in their health can keep them from doing the things that they've always done, leading to a loss of independence and making them more reliant on others. And major role changes such as retiring can put them at risk, especially men who are more likely to define who they are as a person by their professional career. And that shows the deadly means, like I mentioned earlier. When these life changes and stressors occur, the things that we can do to be supportive really make a difference. Helping the person stay connected is critical. Reach out to show you're thinking of them and that you care by phone, online, or in person. That's harder right now, though. Ask how they're doing and genuinely listen. You don't have to have all the answers or fix anything. You just need to be there for them. If their health conditions are limiting their ability to do the things they used to enjoy, help them discover new interests and hobbies together. Most people who experience these changes will not become suicidal, but those with the risk factors we mentioned earlier might. So it's important to stay alert about mental health conditions and stay connected. I also added in this presentation I'm doing for you guys is specific to seniors, but there's another one that is specific to the LGBT population. And I stole a slide from that one to slide in here because I feel like it's important that everyone realize how much higher the rates are for suicide and suicide attempts in the LGBT populations. So you can see those numbers there, 3 to 4 times higher for youth and adults who are gay and lesbian, and 8 to 10 times higher for transgender adults. So I'm not trying to tell you what you should believe, but I'm trying to tell you that if someone comes to you and you know that they are part of this population, they need help and they need to get to help. And if you're not the person to help them, please pass them along to someone who can help them. Now that we have a better understanding of the scope of the problem and the research findings, next section will focus on prevention. Just like there are factors that increase a person's risk for suicide, there are also protective factors that lower a person's risk. So if you are proactive about mental health and make an effort to get healthier, you protect yourself. Feeling connected to family and community support can protect. When someone is struggling with depression, anxiety, psychosis, or substance abuse, these protective factors that may normally be strong can erode and temporarily weaken. So when that happens, having friends and family to remind us of our strengths can be a tremendous protective factor. Problem-solving skills also help. Life can get really tough, but being able to see a way through problems can be protective. And cultural and religious beliefs. These encourage connection, help-seeking behavior, and they discourage suicidal behavior. Because mental health is so important for preventing suicide, we're going to focus on this topic for the next few minutes. Getting effective treatment for conditions can prevent suicide. Critical to suicide prevention is getting people connected to treatment. One of the biggest challenges in fighting suicide is getting people to address their mental health in the same way they would for physical health. Of those suffering from a mental health condition, less than half seek treatment. So we need to treat this like any other aspect of our health. And there are certain times when a person becomes ill, it's critical to seek a trained professional. But we need to change our culture where everyone knows it's smart to take care of our mental health. I think that is one thing that COVID has done for us right now. I think we are talking about mental health more and more. And I know I'm more aware of news articles about it, and you probably are too, just because there's so much going on right now. Taking care of our mental health is just as important in taking care of our physical health. So seeking a mental health professional is a sign of strength, and many people are trying to take that step, including telehealth right now. We need to get a thorough evaluation to figure out what's going on and getting the right kind of psychotherapy and medications. We need to find the treatment that works best for the individual. The good news is that advocacy efforts are improving access to mental health services so that more people can get the treatment they need. The law now requires insurance plans to cover mental health services on par with physical health services. If we need mental health services, and 1 out of 4 of us will, we should get treated and get our health back on track faster. Just like people can find strategies that optimize their physical health, people can do the same for their mental health. So here are some proactive self-care strategies: sleep habits, exercise, nutrition, stress management. Prevention efforts also include support for those touched by suicide. As I mentioned before, it is very common for a person who has lost someone to lose someone else in the family. So it profoundly impacts many. And it's important that survivors have the support they need, both to heal and to reduce their own risk. Those with lived experience, those who have attempted suicide, or those who experience suicidal thinking are at increased risk. We need to make sure that they have the support they need. So I said before, the most important thing that you can put between a suicidal person and their way of ending their life is time. Research shows that by temporarily reducing a person's access to lethal means, we give these individuals time for the increased suicidal risk to diminish, and time for someone to intervene with mental health support and resources. As I mentioned, people have a plan A, but not a plan B. During a period of high risk, the safer their environment is, the better chance a suicidal person has of living through that crisis period. Suicide prevention research has looked at a number of ways to create safer environments. Installing an inexpensive carbon monoxide sensor that would automatically shut cars off if carbon monoxide levels reach unsafe levels would save lives. Installing barriers on bridges deters suicides, and in many cases, they actually lower the suicide rate for the entire region. Restricting access to potentially lethal medications reduces suicides and can be as simple as requiring lethal drugs to be sold in blister packaging. And firearm safety. This is critical to reducing suicide rates. Firearms are used in roughly half of all suicides in the United States, making suicide prevention an important part of gun safety education. AFSP2 has I'm going off script here again, AFSP has a program for gun store owners and firing range owners. we realize that the last thing that those people want is for someone to come in, buy a gun, and use it in the parking lot. That would not be good for anyone. So we are trying to reach out to them. And as you can imagine, it's not an easy discussion overall. I think there's a little bit of like, wait a minute. But I think it's important to try to have those conversations and to help those store owners and gun range owners recognize a person who might be at risk and maybe just ask a few more questions. You know, if someone comes into a store and, you know, they are a hunter and they're talking about hunting, then that's one thing. But if someone comes in and they're like, you know, they're not quite sure what they want, they don't quite sure what they need, I don't think it would take a whole lot to ask a few more questions and to try to help that person and get that person to help. So what you specifically can do. It's important to have a caring, supportive conversation with someone you might be worried about and allow them to share what they're experiencing. It's a way to show that you care and allows you to gain more information about their level of distress. So, watch for the warning signs. While many of the suicide risk factors we discussed endure over a long period of time, some warning signs are observable that can signal a risk in the very near future. So it's important to pay attention to both the risk factors discussed earlier and the warning signs we're about to now. So if you see warning signs, reach out to the individual that you're concerned about and reach out to others if you are struggling. Seek mental health services if you are depressed or if your anxiety regularly interferes with your daily life, and encourage others to do the same. Suicide warning signs are typically displayed in three main ways that we can detect: talk, behavior, and mood. We'll talk about each one of those. Many people who are suicidal talk about ending their lives. This may be directly or indirectly, and a person who might say it outright or they might joke about it, but either way, you've got to take it seriously. Someone might say, I have no reason to live. They might let you know that they're feeling trapped or that they're feeling like a burden to others. Or they might talk about feeling overwhelmed or being in unbearable pain. Behaviors that are atypical for an individual should also encourage you to speak to that person about what you're noticing. So people thinking about suicide display certain behaviors. They may be using alcohol or drugs increasingly. They might be having trouble sleeping, experiencing insomnia, or maybe sleeping too much. They might act more recklessly. They might withdraw from activities, especially from activities they normally enjoy. They might isolate themselves from family and friends, or look for a way to kill themselves, such as searching online for methods or shopping for a firearm. And people who are at risk can display, sometimes subtly, any of the following moods: depression, apathy, rage, irritability, impulsivity, humiliation, or anxiety. Moods you would expect of someone who feels overwhelmed and desperate. We all have our ups and downs, but when you notice a change that seems uncharacteristic or concerning, it's important to speak to the person about what you're noticing. And sudden unexplained happiness. Happiness can indicate that the individual has decided on a plan and is relieved that they will no longer be in pain. So that's a lot to look for. So to sum it up, look for changes in behavior and trust your instincts. Assume that you are the only one who is going to reach out. In too many instances, people talked about their concern for someone amongst themselves, but they did not reach out to the person directly. So here's a rule of thumb. If you are wondering if someone is depressed or overly anxious, that's a sure sign that you should reach out. And the same goes for you. If you are having suicidal thoughts, it's a sure sign you need to seek help. If you've reached out before, reach out again. The first time, the person may not be receptive, but keep trying. Try talking to someone else or with a professional. And if suicide turns out not to be a concern, then they may still be in distress. They may still feel comforted and supported just by knowing you care and that you are taking the time to listen. And I like to remind people that if I've been talking and a person has been kind of running through your head this whole time, That's who you need to call, and you need to call them today. And you can say something as simple as, I listened to a program about suicide prevention and I thought about you and I realized that I worry about you and I need to hear from you how you're doing. It's as simple as that. If they are not thinking about it, they are going to tell you that. They are thinking about it. They're going to appreciate that you reached out. So how do you reach out? Talk to them in private, listen to their story, express your concern and caring. Ask directly about suicidal thoughts. I think this is probably the hardest thing that some people are afraid to ask that question, but don't be afraid. Are you thinking about suicide? Are you thinking about ending your life? If they're in crisis, get them to help. Some things to avoid minimizing their feelings. Those of us who have never experienced a major depression literally cannot imagine what it feels like. Avoid trying to convince them that life is worth living. If a person is nearing a crisis point, they're not thinking clearly. So a debate about life being worth living tends not to be helpful. And avoid advice to fix it. Again, if the person was having a heart attack, in the middle of it, you wouldn't start trying to tell them to start exercising or to eat healthy. So if they're in a crisis, what they need is to be heard and then led to help. Listen to their story, offer to help them find a health professional, help them take active steps towards keeping their environment safe. If you think they might be making an attempt on their life soon, stay with them, unless it puts your own safety at risk, in which case leave the area immediately and call 911. Help them remove lethal means or remove themselves from the potentially dangerous area and escort them to mental health services or an emergency room. Help them call the Suicide Prevention Lifeline or call the Lifeline yourself, and a trained counselor will tell you what you should do to help the person in distress. If they don't feel comfortable speaking to a counselor on the phone, they can also text TALK to the crisis line at 741-741. Now would be a great time to take out your phone and put that number in. I'll give you a minute to do that or to write it down. I'm also going to follow up with some resources to George and Barbara, and hopefully you will get those by email. Y'all have probably heard that there's going to be a national 3-digit number soon. That's based on the efforts of a lot of people who have been advocating for that for years. We know to call 911, or we know to call 411, or I think it's 811 to dig. So there's going to be a new number soon, and there'll be a huge campaign to let you know what it is. But in the meantime, it's this 1-800-273-TALK. If it's an emergency, such as a suicide attempt in progress, of course, call 911. Together, we can create a culture that's smart about mental health, will save lives, and vastly improve the lives of many more. Thank you for joining us today to learn about how talk saves lives. It's a simple idea, but it works. I'm going to email you guys this link, but it would be great if you would go on and give feedback about this. These presentations are usually done live, obviously, but with COVID-19, we're trying to do them more via Zoom, and I think it works fairly well. So you could give your input about that. I will also send the information about how to become an advocate. There are emails that go out periodically that say something as simple as call your representative or your senator and ask them to vote yes on whatever. Y'all know the Affordable Care Act has been a little bit at risk lately, and that might be something that AFSP will reach out to people and say, please make sure that you call your congressman. And I'll also send you a resource sheet. So here are our sponsoring partners for today. I'm going to stop talking, and I think I'll go to them. I think I have one more. There you go. That's my last slide. And I'm right here. If people have questions, I would love to have a discussion. I know that was a lot of information in a short amount of time, but I am here.
Elaine. We do have a few questions.
Okay, I'm ready. I'm going to try.
The first question was, can you tell them what not to say and what to say?
Well, so yes and no. So I think it goes back to you trust your gut, and you probably know that person just as well or better than someone else. I remember a story about a woman who told me that when her ex-husband had been threatening it, she said to him, well, if you think that I'm going to give you a big old funeral and let everybody come and say goodbye, you've got another thing coming. So she kind of bullied him a little bit out of it. And then she said to me, I probably said the wrong thing. And I was like, well, if he lived, you said the right thing. So my point is, she knew him well enough to know what he needed to hear and what would get him out of it. I don't think that there is a right or a wrong, except for what I said earlier about try to be specific. They say not to say something like be thinking about hurting yourself, because that's not specific enough. Are you thinking about ending your life? Are you thinking about suicide? Are the two phrases that I've always been told are kind of the most direct, and that, but it takes a little practice. You might have to really gear yourself up for saying that, because it's a hard phrase to say to someone. And I think, again, what not to say is there's probably realizing that you want an honest answer. So what not to say would be, you're not going to do something stupid, are you? Because that might prompt the person to go, no, I'm not going to do anything stupid. And when in reality, they are thinking about it. So you want to ask in a way that you're going to get an honest answer, whether it's a yes or a no. I hope that helped.
Yes, it did. Another question was from Pam. She's heard people say that the person who completes suicide is being selfish or only thinking of themselves. She thinks this is an incorrect way of thinking, but they don't see things that can get better. What are your thoughts on it?
That's exactly right. I mean, when people do this, it's kind of like I said earlier. If you're having a heart attack, you might be able to croak out the words "call 911," but you're not going to be able to say, "I live at this address. I have been feeling this way lately." I mean, it is literally your brain kind of contracts into that very moment, and they can't and don't stop to think about how this will affect other people. And I'll give you an example about that. I had a friend whose son died by suicide, and his wife, of course, was just devastated, the mom of the boy who died. And she ended up going to treatment to our Palmetto Health day treatment program, and was, of course, in terrible grief, was telling a group of patients about what had happened. 2 different people came up to her and said, "Thank you so much for sharing your story. I've been suicidal, and I never once thought about how it would affect my mother." They couldn't even think beyond what was going through their own brain at the moment. So I think if 2 different people told her that in the space of 5 or 10 minutes, how many people are also like that? And I think that's the majority of people. Like I said, they can't think beyond that very moment. They can't stop and think. I'll give you one other example. I heard about a girl who was suicidal in college. Her mother was a single mother, and she told her roommate, she said, "I think if I just were to die, Mom would not have to worry about all these expenses." And thankfully, the roommate called her mother, and that mother was like, "Are you kidding? Think about what you just said. First of all, the funeral, and again, trying to just snap her out of that situation, but to give her some context of this isn't just about, yes, you think you're doing this to protect someone, but what you're doing is really starting a domino effect of something much, 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 much worse that they hadn't even thought about. I hope that helps.
Yes, it did.
Okay.
Can you please show the slide again of what not to say about suicide?
I think that's this one. Let me go back one more. Yes. Does that help?
Yes.
Okay.
What would you say to an individual that wants to know how to handle a person if they come across a phone call of someone thinking about it?
I think some things to say would be to ask questions about who is around, who is near that person, what is part of their support system. Do they have someone that they talk to? I tell physicians all the time that a great phrase is, do you have it sounds like you're going through a lot. Do you have someone you can talk to? And then listen for the answer, because the person may have a therapist. Great. They may say, yes, I talk to my mother. Well, that might not be the most helpful person because they might not know how to help you, but they are a support. So just asking, who do you have, who is part of your community, and then finding out, you might have to say, it depends on the situation, you might have to say, may I have their number? Or if y'all, I don't know how detailed y'all's records are, you may have the number of that family member. You may have to say, may I call? Or I'm worried about you. I'm going to call your daughter, or I'm going to call your doctor. Or how about if I stay on the line, or let's hang up, you call, and then I'm going to call you right back. So thinking about the things that you can help them do. Or if it sounds serious, like I said, you might have to call 911 and say, I'm talking to a person at this address and I'm worried about them. Does that help?
Yes.
Okay.
We have another request. Can we go back to the attempted versus completed slide?
The 25 at the very beginning?
I think it had the terminologies to use and not to use.
Sure. I'm with you now. Sorry, there's probably a better way to do this. I probably could have gone to the beginning there. And I'm telling you, everybody still says committed. Everybody. But the thinking is that a person commits a crime so that they maybe are thinking clearly when they commit that crime, or it just changes the dynamic of the conversation. I mean, think about if you said this person died by suicide, or a person ended their life, or a person killed themselves. I think it just sounds different in a person's brain than committed suicide. And you may not agree with that. I don't think people have to agree with it. It's just research is showing that these are better ways to talk about it.
Would you say that this is intervention in a way of trying to change the culture that thinks of mental health as a stigma?
Absolutely.
So this would be, if once we change the dialogue and we change the verbiage used when talking about suicide, could we possibly get to a place where mental health is no longer looked at as a stigma and everyone would go and seek help?
Absolutely. And it could be, honestly, COVID doesn't have a lot of pros. There's a lot of cons, but maybe one of the pros is that people are talking about mental health more. Y'all are, so I've been trained on suicide prevention for 16 years. And I used to do a different presentation. Now I do this one for Talk Saves Lives for AFSP. But I, 've been trained on suicide prevention for 16 years. And I used to do a different presentation. Now I do this one for Talk Saves Lives for AFSP. But I, 've been trained on suicide prevention for 16 years. And I used to do a different presentation. Now I do this one for Talk Saves Lives for AFSP. But cannot tell you, just in this week alone, y'all are my third request. So I'm going to do it again next week. And I did it last week for someone. I haven't done 3 in 3 weeks in ever. So I think that I appreciate that people are trying to be proactive and they are recognizing that it isn't just people with mental health issues, but right now it's all of us who are being affected by having to isolate or being worried about germs and anxious and worry about the future. There's a lot of going on, and this is the time that we have got to reach out to each other and support each other and help each other. And thank God for telehealth. One of the resources I'm going to put on the resource page I'm sending you guys is Psychology Today has a website where a person, you go to the website and it says, I'm looking for a therapist. And you can say, I have this insurance. I'm looking for a female. My problem is anxiety. I also have LGBT. I'm part of that community. So you can drill down and find 2 or 3 therapists. I haven't looked at it lately. It may have telehealth capability on there now too. If it's smart, it does. So that people can get help finding the right person. They don't necessarily need a psychiatrist right away. They need a therapist though.
What are some ways we can reach out to our seniors in this time of COVID and isolation?
Well, I mentioned at the very beginning that I'm part of that group called the Friendship, and that's exactly what we're doing right now too. We have members, who are part of the organization, and we have a group of volunteers who reach out to them some of them every day, some people every other day, just to check in, to have a friendly voice. I think people need to feel that they are not completely alone and that someone cares and that someone would notice if they weren't here. And I think that's kind of one of the most sad things about all of this, but especially during this time of COVID, that people can be just so isolated and they can begin to think, who would even notice if I wasn't here? So y'all would be the ones who would say that. And I don't know how big your staff is or how many people that would entail, but are there people who could reach out to that person regularly?
I've seen on Facebook where they have nursing homes and assisted living facilities that now are asking for pen pals.
Yes. Yeah.
So I think
that's a
communication is a good way to keep in contact, but let's go back to the pen and paper.
Absolutely. Write a little postcard.
That's right.
Right. Thinking of you. And if get children involved, let them do it. If they were to write, hey, Grandpa, I miss you, or neighbor or whatever.
Thank you, Elaine. This has been a wonderful conversation.
I hope that it's been helpful. It looks like we've got about 21 people on still. So I'll send the link for the evaluation. I'm going to send an attachment that has a lot of resources like AFSP and NAMI and that Psychology Today. And I'm also going to send information about how to be a field advocate for AFSP, because I think that's something that each of you guys can do. Each of you, the people on the call, and anyone that you can put it on Facebook and just stay on top of these advocacy issues, because people need to, our representatives and our senators need to hear from us if something is important. And the ACA and suicide prevention measures are super important to all of us. I've enjoyed being with you guys. I will also make sure that my contact information is on there, and I welcome if somebody just wants to talk to me, and just if there's something that came up during this conversation, I'm here for anybody who wants to talk. My cell phone number is on my contact info. Thank you guys for letting me be with you.
Thank you.
You're welcome. Bye.
Bye. And have a good day.
Thanks, y'all too.